All right, thanks, Evan. Are we good to
Sir,
go here?
I will let you know. It's setting up the meeting for Facebook Live, and it is almost processed.
Okay.
And we are live.
Awesome. Thank you, Evan, so much. Appreciate it. So, hello, everybody. My name is Jonathan Wallace, and it is my distinct pleasure tonight to host a forum speaking about COVID, talking about the pandemic. We have an excellent collection of panelists here, folks who have experience in issues directly facing the disease and things surrounding it, a cross section of professionals in different areas and experiences that I think are going to bring a lot to the conversation. I'm a former state representative for House District 119, but like I said earlier, it's my pleasure to be moderating tonight. This isn't a political thing. This is a thing where we're talking about COVID-19 and what it means. There's a lot of information that we've seen. There's a lot of facts out there. There's a lot of advice that's changed over time. And my goal and my hope for tonight is that we have a great conversation that helps inform you as a viewer and helps you make better decisions going forward, and helps you understand what we can expect in the future. So with that said, I will jump to introductions. We have with us Dr. Mark Abel. He's a family physician and a professor of epidemiology, and he's interested in helping primary care physicians and their patients make better decisions. We have Laura Morse, who received her BA degree in psychology from Spelman College in Atlanta, Georgia, and she's pursued her master's degree in community counseling from Georgia, and she's a licensed certified clinical supervisor and a licensed, help me out here, Laura, licensed
professional counselor.
Professional counselor. Thank you so much. We also have here with us Dr. John Drake. He's the biological modeler who specializes in data science of ecology and epidemiology. He's worked on the West Nile virus, Ebola, white nose syndrome, and avian flu, among others. He's focused his recent work on using new methods from machine learning to mining biological data sets for new patterns. And he's studying the biodiversity of freshwater ponds, working on the mathematical theory of extinction, and reading history and philosophy of 20th century biology. And John is also the director for the Center for the Ecology of Infectious Diseases at UGA. And finally, we have Shonda Santana, who's going to be rolling in here in just a few minutes. She is currently on another call. And so she is the executive director and founder for Divas Who Win Freedom Center. And it was established in 2018. And Ms. Santana felt compelled to come out of the hedges of darkness and stigma, which polarized the issue of sex trafficking and substance use disorders. So she shares her personal stories of her experiences with her teenage daughter being rescued by the FBI from a family of traffickers. And so with a newfound mission, as its founder and the board of directors launched Divas Who Win Freedom Center to serve as an oasis of safety and refuge for those suffering from a substance use disorder, entangled in the world of sexual exploitation, or victims of sex trafficking. So as I mentioned on the illustrious panel, we're going to jump right into it. We've got a fair amount to discuss, and we're going to give ourselves the next hour or so to speak about it. And so this question is sort of open to everyone if you have something you want to add here. But our understanding of COVID-19 has changed significantly since it spread to the United States. In that time, there have been many moments of uncertainty and public debate surrounding what efforts should be made to promote safety and how effective those methods are. Many of these concerns still exist today as our understanding of the virus continues to grow. So I'd like to ask each of you, can you speak to how our knowledge of the disease has evolved? What actions can we take to better protect ourselves with some amount of certainty? And Dr. Abel, I'd love to start with you if that's okay.
Sure, John. Thanks for the introduction. Good to be here. I think one of the best examples of how our knowledge has evolved has to do with wearing masks. And early on, there was less certainty about how effective masks were. And there was also a concern that masks would be diverted from frontline providers to the general public, so there wouldn't be enough available. But that understanding has really evolved. There's been a lot of good science done. And I think a really important thing that we've learned is that many people, especially younger people, are asymptomatic, but still can infect others. And they don't know that they're sick. They don't know to isolate themselves. And so by assuming that we all could potentially spread the virus, that's how we can slow the spread. And, wearing masks is a big part of that. So our understanding has certainly evolved. Treatment has evolved. I think you're much better off getting sick now than in March, for example, when much less was known about how to manage ventilators. There were no good treatments. We didn't know who should get steroids or whether they should get steroids. Lots of issues like that. So I'll let others chime in. I don't want to overspeak.
Yes, great. Dr. Drake, do you have something you would like to add?
So Jonathan, I think it's important that people remember that 10 months ago, none of us had ever heard of COVID-19 or SARS coronavirus 2, which is the virus that causes it. So you're right when you ask the question, we're still learning a lot about this virus. One of the things that we don't have any information on is the long-term consequences. Why? Because we don't have anybody who's had it long-term yet. So, it's that kind of information that we're going to continue to get. I agree with Mark that we've learned a lot about the disease, its progression, how we treat it, and also how we can prevent transmission within communities. I agree with Mark that masks are really important. Masks aren't the only thing though. So for instance, maintaining just a certain amount of social distance. I don't think that we have to be quite as draconian as we were back in March and April. We've learned lots of ways to put distance between ourselves and other people in ways that are really effective at reducing transmission. So for instance, one is if you're going to meet up with people, meet up with them out of doors in a place that is super well ventilated so that if somebody is infected, they're much, much less likely to infect others in the group. And even while you're meeting up out of doors, keep that social space between you. You can still have a conversation at 6 foot distance.
Fantastic. Yeah. So mask usage is something that that we find is still not universal. And there's other recommendations that you mentioned, social distancing, also testing, which some folks are hesitant to engage with. And I'm curious, what actions do y'all see that we folks can take at the organizational level for schools, community leaders to do in order to incentivize folks to follow the proper protocols, the safe practices that we should be doing? And I guess one of the other questions that comes to mind is, are there any analogs that you see in other public health crises that we've faced in the past? Are there learnings from other things that we can pick up and follow, best practices from other public health crises that we've faced?
So if I can jump in there, Jonathan, one thing I would say is lead by example. If you're a leader in any context, in your home, with your extended family, in your neighborhood, in your place of work, lead by example by wearing a mask, just a little bit of social pressure to remind people that, yes, it's still important that we keep our distance, I think can go a long way towards sort of spreading understanding and safe practice.
I'm not a doctor, medical doctor, but I think about, appreciate what Dr. Drake shared about leading by example. And when you talked about an analog for a public health crisis, I'm old enough, I was in college when Irvin Magic Johnson, famed basketball star for the LA Lakers, contracted HIV and became public with it. And up until that time, most of the Black community was focused on HIV and AIDS as a white male disease. And so the idea of wearing condoms and having protective sex was just, it didn't need to be done. Right. And so I was a senior at that time, and we knew that it was starting to spread within the Black community through, intravenous drug use or unsafe sex. And him coming out really, really shifted. I mean, we still talk about it at reunions, what that meant when we heard. We all remember where we were when we learned that Magic Johnson had contracted HIV. He was HIV positive. And because he was very focused and he didn't hide, and he said, this is what's happened to me, promoting safe sex, it made a huge impact on the Black community, especially for Black men and Black women too, to say, you know what, we're not going to do this unless you protect yourself, because now I know that I'm vulnerable, right? We still have concerns, and it's a different age now where young people in the Black community are like, well, there's a pill for that, right? But back then there wasn't, and there was a lot of fear. And so just to have people who are respected and not afraid to say, this is what I choose to do to be safe, it is influential. So,
Yeah, I'll jump in because I want to talk a little bit. I think that was right on point. And I was taught at Michigan State, and I was at the same health club where Irvin Magic Johnson was a member, and I used to see him playing basketball after he'd retired, which was a real
Excellent.
thrill for me. But yeah, so we need consistent, clear, concise messaging from our leaders in government, from our leaders in the community, leaders in organizations, corporations. We need to tailor messages to our audience. We can't communicate with 70-year-olds and 40-year-olds and 12-year-olds using the same media. We need to be creative. I saw TikTok messages this morning about how to wash your hands and doing dances around how to wash your hands. That we need to think creatively, but we have to be realistic. We can't give false hope. There are leaders who've been real examples around the world in communicating clearly, honestly, and telling the truth to their audience. And I think that kind of consistent messaging is something we have not seen in our country, certainly at the national level, and I think that's been a real challenge for us.
Yeah, so that sort of leads me, we've had some messaging that's been inconsistent, and it feels like some of that's due to us learning some more about the disease as we go, and learning how we can best respond to it, how we can best treat it. But there's also disinformation. This might not be in anybody's particular background, but if you have any thoughts about how do we combat that disinformation about the coronavirus, how do we ensure that folks are following the concise, consistent messaging? Is there stuff that we can do on an individual level? Is there stuff that we can do as citizens or students or leaders in our family? What are the things that we can do to help push back on that information? Who should we be listening to?
So, disinformation, I think, feeds on fear. And understandably, this is a virus that we don't know a lot about. It does cause people to become sick. It does sometimes lead to death. People are afraid. And I think it's important to acknowledge that. But at the same time, I think in life, we can face those fears. And I think part of that consistent message is showing confidence that if we do the right thing, we can defeat this epidemic. And it doesn't have to take hundreds of thousands more lives from our society. So you asked the question about how do you guard against disinformation? I would say look for the hype. When you've got plain spoken, clear, declarative information backed up with credible facts and figures, that's probably pretty reliable. But when the information is presented in such a way as to cause you to react to it, it's probably misinformation. One resource that I would point people to is the CDC's website. Does the CDC know everything about this virus? Certainly not, because nobody knows everything about this virus. But they are updating their website on a regular basis, and their information is generated for a wide range of audiences, ranging from physicians and hospitalists and medical administrators down to individuals like you and me advising what we can do. I think it's also important to realize that just because the information changes doesn't mean we're doing something wrong. I think sometimes we have the impression that if somebody changes their mind about something, they must be fickle, right? Or maybe they don't know what they're talking about. But that's not how it is in science. In fact, in science, we hope that most of the time we're changing our mind because we're learning more and more about whatever it is that we're studying, in this case, the virus and how it spreads in our community.
So you were mentioning sources of information. Evan, if you could toss up those links into the chat. I'm the editor of a medical reference for family primary care physicians, and we have a chapter on COVID-19 that we're continuously updating. It's freely available. It's not behind a paywall. And so there's a link to essentialevidenceplus.com. And, I think stories can also be helpful to you, when you're trying to convince people about masks, stories, analogies. I talk about masks like a speed limit. You don't have a speed limit on Prince to protect the driver as much as you do everyone else around them. Surgeons don't wear a mask in surgery to protect themselves from the patient. They want to do it to protect the patient from what they might cough or inadvertently expel from their mouth. There was a great story. It was in the CDC's publication called MMWR. And they told the story of two hairstylists in a salon who were both infected with COVID-19. This was early on in the pandemic. They didn't know what they had. They hadn't been tested, but they eventually were, and it was confirmed they had COVID. They did the hair of 129 clients during that time, 127. They were all wearing masks. Had made everybody wear a mask. They were wearing a mask themselves. No one got infected. That kind of story of that close contact between the hairstylist and their clients, 127, none of whom got infected, was really powerful at convincing folks that, hey, this is something that really does work. And so I think stories can be helpful, and leading by example and acknowledging that we don't know everything. We should have had somebody get up from CDC or someplace in March and say, hey, we're going to tell you some stuff that ends up changing. That's the way it is with science. And unfortunately, there was, maybe that didn't get across as clearly. Other countries, other leaders did, say that this is going to change, this is going to evolve. I'm giving a talk Friday to the Arizona Academy of Family Physicians on COVID treatment. And I begin the talk by saying, some of this is wrong, but, we'll know that next year.
Yeah, it sounds like one of the challenges that we've seen and is that, folks want to return to normal. And I think Ms. Santana and Ms. Morris, you might have some input here is when folks are struggling to climb out of, reach back to find their new normal after facing adversity. What kind of advice do we have for those folks who maybe have experienced the disease, or maybe they're struggling with, the mental health of impacts of not being able to live their normal life and being, struggling to, see friends on a regular basis because they are following the guidelines and the protocols. Would y'all have any advice that folks can use to help them, can commit to the good protocols and the policies that are keeping folks safe, but help them overcome those challenges?
Yeah, so I'm Shonda, founder of Divas Who Win. And so we serve, a high risk category of individuals who are recovering from substance use disorders, coming out of prostitution, and sex trafficking survivors. And so we have watched, for us since March 15th, our doors have been closed a total of 12 days. So we've remained open, but what we found is that, I made a note here, with our data. So let's see, June of 2019, we served 178 people. And then by July of this year, we served 592. So what we see is that people need more help. And because the group setting, so we offer multiple pathways to recovery and support groups, but because of the guidelines and keeping the group sizes to 10 people or less, the groups have disseminated somewhat. But what we stress to our peers that come here is that it's about the connection. And as leaders, I think it's our duty to get as creative as we can. Funding may be down, but services are certainly up by about 30% for us. And so we have to get creative with our business hours. We have to get creative with our internet hours. We have to recreate programming that fits. And another note that I made for myself was that the individual connections, where we did 178 one-on-one check-ins August of last year. We did 500 plus August of this year. So people are needing something a bit more intimate, a bit more personalized, a bit more cultivated and curated for their specific needs, because we're already talking about a people group that has so many barriers to just well-being. And so our advice to our peers is to stay connected and to let them know that we're in this with them for the long run. And if that means that, we stagger our staff so someone can start responding at 7 a.m. instead of 9 a.m., that's just what we've done, because as an impact of COVID-19, we have seen, unfortunately, mental health breakdowns that resulted in, suicide, that have resulted in people going back into the sex trade industry resulted in overdose deaths, you know. So the inspiration for us as a leadership team is we want to do all that we can to try to get that number going back in the right direction. And what is required for us in our work is eyeball to eyeball, even if that's on FaceTime, you know, one, slowing down the pace and just one person at a time. And that seems to be the need. And that's what we're chasing behind.
If I could add to what Ms. Shonda was saying, I'm a psychotherapist in private practice, but all of my clients have switched over to telemed for my safety and for others. And so I would say that it's been my most lucrative year ever in my career, sadly, right? And so the need for services is great, as Ms. Shonda said, and I'm a private practitioner, which means my rates are higher than what a lot of people who need services can afford. And so organizations like Ms. Shonda's, or I serve on the board of a Covenant Community, which is a place for homeless men who are recovering from alcohol and other addictions. They're full to capacity, and they have a lot of other considerations like safety protocols, et cetera. And it's difficult, but those connections matter for recovery. But just in general, I think that collectively we have been in a grief process and a grief cycle in ways in which we've never really seen. There's so many. Just one moment, please.
No worries. We're all used to the Zoom life these days.
Oh my goodness. Oh my God. The dog's busting up in here. I'm trying to be professional. And so you have to make adjustments, right?
Exactly.
You have to be in tune with your own feelings of frustration. But, you know, I think for many people, they are very surprised at the strength of which they have felt sadness or anger or fear, like the doctors were talking about. And so we all have our own responses to that. So when people are afraid, a lot of times they might be compliant until they're not afraid anymore. Real change isn't going to be based on fear long term, right? Real change is going to be, how does this actually benefit me? And how can I buy into that versus how can I avoid something? You know, avoidance will get people in the door, but really the benefit of it is what the other side of it, and creates a lasting change. So I might be veering off topic a little bit, but I do think that it is now more important than ever to find ways to connect. And to Ms. Shonda's point, the creativity around connection, right? Finding ways to accept that this is not ideal, but it's better than just being at home by yourself or isolating. I think self-care is a really, really big issue as well. When we can think about, I'm going to wear a mask because I want to protect others from, my own health or what have you. Some people might be like, well, I don't have anything, so I shouldn't have to wear a mask. But we all know somebody who could be vulnerable, right? Even if it's just based on age, could be based on health. And so looking at ways to take care of ourselves so that we can be around those other people that we care about and not do harm to them. I wish more people could kind of think of it in that term instead of, well, this is only about me and I want to go do other things, instead of what that would mean. It actually could create more disconnect. So those are just some early thoughts that I have on the topic.
Yeah, it really gets to some larger issues in our society about how in America we are so uniquely in many ways valuing libertarian concepts over communitarian concepts, where we want to do what's right for our community. And I think the messaging could do more to emphasize the positive things, how doing these things it's not a negative, it's a positive to help your community, to help those around you, to prevent disease. I saw patients this morning, telemedicine wise, whoops, looks like my video went away. I'm not sure why. I saw telemedicine patients this morning for Mercy Clinic, where I volunteer. And we often end up having a part of the conversation around, what are you doing to stay sane? What are you doing to get outside? What are you doing to connect with people? And I kind of hate that term, social distancing. It's physical distance. One of my friends, who's a very smart person, said, no, it's physical distancing, but let's work on social closeness. Let's work on, maintaining and building those connections. This is maybe not the best example, but I have a happy hour every Thursday with my friends from college. And we used to connect a couple times a year. Now we connect every week. And so there are some ways we can, it's not ideal, but we can still connect and even strengthen some of those connections.
I think that's right. Our society at the moment is just being torn apart by tension and conflict. And I think with this epidemic, what we have is something that is an enemy that we can all join forces against. It is something that I believe that we can defeat, but that takes cooperation. It's not something that any one of us can defeat on our own, because an epidemic is by its nature a collective event. And I think that one of the things that would show what a resilient society we are is if we could join together in determination to reduce transmission, prevent future deaths, engage in social work and personal habits and activities that prevent ongoing spread, and defeat this and keep it down until we have more medical countermeasures, vaccines that hopefully will help us to keep it down for the long term.
Yeah, it seems like one of the challenges is that that our context has changed, right? So you mentioned at the very beginning, I think, Dr. Drake, around, in the spring we sheltered in place for a period of time in Georgia, and then we stopped doing that because some certain decisions were made. But at the time, the concern was that we were going to overwhelm our healthcare facilities. And what I'm hearing from Ms. Shonda is that we are still overwhelmed, and from Ms. Morris is that some folks still are experiencing an overwhelm. It's not it's not a life or death issue, I hope, in most circumstances, because I think the concern was that we were going to overwhelm their emergency departments with folks who were sick. So we've learned some more, but I'm curious what y'all's thoughts are about how things may change going forward. I know it's hard to predict the future, but how do my actions need to change if things are going well in terms of containing the spread of the disease? What does that mean for me as an individual? What does that mean for my community and my state? I'd love for y'all to speak to what you see in that regard. How do we change our behaviors when our context changes, when our conditions change?
So one of the things that we're doing is it's like we're driving a car down an icy road, right? And when we hit the ice, we slowed way down, but then we speed up again. And we need to not be shifting between the brake and the gas. We need to take it slow when we start to speed up, take it very slow and observe what happens. As we're entering the fall and winter, which is the typical season for respiratory illnesses, we're not sure what consequences that's going to have for the continued transmission of SARS coronavirus 2, or influenza for that matter, or how they're going to interact with each other and with the other diseases that often come around this time of year. So I think part of the answer to your question about what do I do about my behavior, I'd say take it slow.
Yeah, you said when it's going well, what do you do? It's only going well if you're doing the right things, if we're all doing the right things. And if we stop doing the right things, we saw what happened in June and July, and it wasn't pretty. Right.
Yeah, I'm sorry, go ahead.
No, I wasn't going to say that.
Ms. Morris, it looked like you were about to jump in.
I was going to jump in, but I think I'll hold. Well, no, I won't. So I think about from a psychological perspective is what we see, and I love Dr. Drake's advice about taking it slow. When you look at our country, though, and you think, okay, well, in Florida now you can go to the bars and you can go to restaurants without restriction, right? So of course, I don't know if you've seen it, but there's video of people just having a grand old time, and it's very crowded, and you would not think that there was anything going on. And I thought to myself, well, Georgia's going to be next in that, right? And if you say, well, you can go to the bars and restaurants, then why do you have to wear a mask when you go to Publix and Target or Costco, where, you know, all Publix and all Targets and all Costco's, from what I understand, are saying you must wear a mask to go in, right? But then it's hard psychologically to say, well, why is this okay here and not okay there, right? And I think when people see these mixed messages, then you start kind of pushing your own narrative. And the narrative could be, I really miss being at restaurants. I really miss being inside at a bar. And I see that it can be done, so to speak, right? So I like to call it like the tale of two cities, but one virus, right? And it becomes really, really important to kind of think, what do I value now? What is my own personal situation? What is my family situation? And how I'm going to take care, how can I take care of me and the people that I love? And I think that's the conflict right now that I'm seeing. I know that I feel fortunate social media wise at times, if you're going to call it fortunate, to have people that are of all races part of my Facebook feed. My cohorts that are Black and brown, there's one degree of separation between me and somebody that I know who has personally lost someone to COVID. Okay. My other friends that are not Black and brown, we had a touch of COVID and everybody was fine. And so it's not that big of a deal, right? And so that's two different perspectives. And both of those are true, right? But one feels dangerous to me. And maybe for them, they might look at, oh, Laura's overreacting. Why won't she come out and have coffee with me inside a Starbucks? Because I'm not doing that, right? And this is the reason why, because we laid to rest so-and-so. And so it's just interesting, just the psychology piece. I always say that we're going through such an interesting time that if I weren't living in it, I would be fascinated, right? Maybe one day hopefully I'll get to do that, right? So that's all I wanted to add on that.